There's a famous Bruce Lee quote that deals with mastery. And the quote, and I'm probably going to butcher it, goes something like this: I fear not the man who has practiced 1,000 kicks once, but rather the man who's practiced one kick 1,000 times. And the same applies to medical settings and procedures, depending on the context. So what I'm going to get at here, I'll explain in more detail in a minute. The same analogy in a more simplistic way could be, you're not going to ask your plumber to install your custom wood flooring that you bought from Brazil, right? The same goes with cardiology. There are a variety of different types and skill levels and procedural competencies of cardiology, and I'll kind of cover these in a brief format here for you as well. So the most common is just general cardiology. They deal with heart attacks, heart failure, valve problems, just kind of general cardiology topics, just like your family doctor deals with blood pressure, birth control, chronic pain, headaches, all those things. The same is said for most general cardiologists. There are invasive or procedural-based cardiologists that are doing procedures. They are doing heart caths, where they're going in through an artery and opening up a blockage in the heart for people who've got heart disease or have suffered a heart attack. There are those that specialize in heart valve problems, where they're looking at imaging such as echo, which is basically an ultrasound of the heart, and they are specifically focused on that. And there is a whole training program that goes around all these. More invasive and more, in my mind, complicated yet is the electrophysiologist, or the electrician of the heart. And I'll be seeing one of those next week, and I'll fill you in on what all that entails afterwards. But they go through an additional 2 years of cardiology training that specializes in diagnosing and treating the electrical problems of the heart. The heart is wired just like your house, essentially. There are different circuits that communicate between different chambers and different parts of your heart that generate the normal lub-dub heartbeat that you're all familiar with. A variety of things can happen where that's erratic, it's fast, it's slow, and that can require the intervention of a cardiologist, whether they're going to go in with a catheter and either burn or freeze the abnormal circuit, if you will, restoring normal flow of electricity through the heart to treat this arrhythmia, or dysrhythmia is another way to say that. Sometimes a pacemaker is required. But the bottom line is that depending on the cardiac problem at hand, it may not be as simple as just seeing your down the street cardiologist. It's a great starting point, but keep in mind that there are a variety of skill levels, different levels of training, and fortunately, into the modern age of internet and research and the availability to travel, it's quite easy to see somebody who is quite expert and has a track record of expertise in the particular procedure that you might be facing. So I hope you found that helpful. I'll be filling you in next week, post-procedure. I hope all goes well, and I'll talk to you soon.